Okay. Thank you, everybody, and welcome to Adult Social Care Policy Committee, 27th of January, 2025, and this is committee number 5. As we work through the meeting, the policy committee team will display the agenda reports on the screens dotted around the chamber. Okay, so let's just do some welcomes and introductions and safety information. So if I'd like to welcome the members and ask if they can introduce themselves. So if we start to my left, and then we'll so let's start with Councillor Y and then work your way around.
Hi, I'm Tim Y. I'm Councillor for Ashley Ward, and I also chair the HOSC, which has an overlap.
Councillor Joss Clark, Brislington West Ward, Lib Dem.
Councillor Mohammed Makawi, Cotton Ward, Green.
George Kalashone, Green Party, Clifton Down.
Councillor Johnson, Carroll, Labour Party.
Councillor Martin for Froome Vale, Labour Party.
Councillor Mark Weston, Henry Brentry Ward, Conservatives.
Thank you. And if we go to the opposite side of the chamber.
Thank you, Chair. Pete Franklin, Strategic Intelligence and Performance Advisor.
Hello, Mette Lee Jacobsen, Director Adult Social Care.
And I'm Councillor Kelvin Blake. I'm a Labour Councillor for Hillfields Ward.
Good afternoon, Hugh Evans, Exec Director Adults and Communities.
Hello, I'm Bronwyn Faulkner, the Policy Committee Officer.
And my name is Lorraine Francis, and I am the Chair of Adult Social Care Committee. Okay, so thank you everybody for introducing yourselves. And so for the members of the public, everybody, all the members, councillors here make up Adult Social Care Committee. Okay, so let's just take you through the emergency evacuation procedures. So as you know, we have some filming in the building, so just be mindful as you move around the building. But in the event of an alarm sounding, which we're not expecting a fire alarm today, please room the room calmly via the lobby area. So we're lucky that there's no obstructions directly outside. Turn right and walk down the ramp towards the cathedral. Assembly point is in front of the cathedral. We will take a 5-minute break at 5 minutes past 3-ish or thereabouts. That's it. Okay, so let's move on to agenda item 2. We have no apologies, so that's a good start. If we noticed the officers are missing, and we're just trying to see if they're actually going to be showing today. We are quorate as well. Declaration, I needed some water, Tim, you should have got me some. Declarations of interest. Does any committee member have any declarations of interest to declare? Fabulous, I'll take that as a no. Agenda item 4 is the minutes of the last meeting. Can I move the minutes unless anybody has got anything they want amended on those minutes? Okay, fabulous. So is there anyone that's willing to second the minutes? Thank you, Councillor. Okay. Councillor Johnson for seconded. If any member wishes, we've done that already. Okay. So, agenda item 4 is the chair's announcements. Okay. So I think the main things I want to sort of mention today is Adult Social Care, we are the largest single area of Bristol's City Council's general fund budgets, and we're functioning on around £200 million a year net spend So the adult social care budget represents between 40 and 45% of the expenditure of the council as a whole. So as we know, there's, over recent years, the money available to council has reduced, and at the same time, demand on services continue to increase. And just wanted to sort of make us aware that, as we know, as the population gets poorer, more concerned about aspects of their day-to-day lives, their health and well-being can be affected by that. So we know that we have a real challenge in regards to the budget, provision of services, how we provide that service, who receives the service. So there is no easy win or, anything we can do at the moment, budget-wise, to sort of help mitigate against some of the challenges that we face. So I just wanted to mention that. So the budget proposal from all committees were brought to the public meetings of the Finance Subcommittee on the 15th and 16th of January. A link to these proposals were circulated in the committee for reference on the 3rd of February. The Strategy and Resource Policy Committee will determine budget recommendations to be submitted to the full council budget meeting on the 25th of February. So, all councillors know that the procedure is that any political party can make amendments and suggestions to mend the budget, and that would be the expectations of any of Bristol City Council. That's how the system works. So hopefully you get a chance to read in depth again the proposals, and if you do have any ongoing questions, do come and see me, and Hugh is always available as well. So we had our CQC inspection of adult social care. It began on the 20th of January, and I think, was today the last day?
Inspectors formally left the building on Thursday, but
Thursday.
the interviews continue this week.
Right, okay, so we're nearly at the end of, I've noted, and I will get back to you as soon as I finish the chair's announcement. So it was an exciting but challenging and scary time all in once. So I'm glad that we've had our chance to contribute, and it was I think everybody came away feeling heard, at least as a minimum. Okay, so I just saw two hands raised whilst I was running through the chair's announcements. So, Councillor Galasconi, if you want to start.
Yeah, please. I need a microphone.
Oh, you're going to have to, Can you shuffle down to a microphone, everybody, so that there's one per person? Yeah, just adjust the seating, if you don't mind. And then everyone's got one then. Oops. Excellent. Okay. Fab. Okay, Councillor Clark.
That was it. So I just wanted to know if we were going to have an opportunity to discuss the budget today.
What, the budget that's been proposed?
Yes. So if we had any queries, if we could bring them up in this meeting.
That wouldn't necessarily be the norm, because obviously the budget has been published online for members of the public to see, or the political parties to see. At this stage in the process, normally, political parties would be looking at the issues and looking at ways that they can make any amendments or suggestions. That would be the norm. So if we start to discuss the budget, I mean, there are more...
It's a question of really unpacking what's beneath the headlines, really. Was a question.
I don't think that would be the appropriate thing to do in this committee. One, it's not on the agenda, and I think I'm fair, and I'm not being in any way trying to not be transparent, but that this wouldn't be the environment to do that right now, because as I haven't got the order of events, but normally you get a published budget. Political parties get a chance to look at it, unpick it, come up with any suggested amendments. So if we were to start doing that now, I don't think that would be the appropriate thing to do within this committee as it stands at the moment. I've offered, and I will continue to do that, if councillors are minded and want us to continue to have briefings and discussions around the budget, we can do that. But part of the role of each of us is to look at the budget through your own gaze and come up with suggestions about how you think your political party would like to make amendments and adjustments. That's the stage I think we're in now. Hugh, you wanted to have
Thank you.
Sorry.
I don't need to come in. Thank you.
Can I just come back on that? Would there be an opportunity for all members to have maybe an online briefing so that we can unpack the budget so that the committee fully understand? Because I don't know that everybody fully understands the budget and the budget implications for service and service delivery. And I was just wondering whether people might find that useful.
Okay, so I have spoken to everybody in this room, minus, with respect, my two Labour colleagues on the left. So everybody's been briefed. You were briefed just now with the time we had alongside Councillor Blake. Like I said, Hugh and I are more than happy to go through the budget proposals that were published on Bronwyn Friday, but it was on there before as well. But sorry, go ahead, Bronwyn. I know you wanted to say something.
Yes, just to, well, I do recall you flagging this at the agenda briefing. So as an action from that, I circulated a link to the papers or the budget proposals to the members of the Adult Social Care Committee. The papers, as you said, for the 3rd of February meeting have now been published and are available for the public.
Yes, so that would have been December, I can't remember. December, wasn't it? When you?
No, or was it last Monday's agenda brief?
Sorry, two different things. So so you sent a link for the budget as it stood at the time?
Yes, I think I sent a link to the papers of the Finance Subcommittee that took place on the 15th and 16th of January. So all of those were the budget proposals, and then the final proposals are going to the budget, the Strategy and Resources Committee for the 3rd of February.
Yeah, thank you. Councillor Weston.
Thank you very much, Chair. I understand where we are now. I think the committee system, we're all having a bit of a suck it and seeing, we're testing it of how we want it to be. Yeah. I think in the committee system, we are all here in this room culpable for the budget to a certain extent. And I think possibly, at the very least for next year, we might want to have a committee briefing on what is in the budget, since we are all, as part of this committee, responsible for it. We are where we are now, but I think next year we probably should factor in, even if in private, an online briefing as to what is in the budget, so everyone is totally cognizant.
I did do that because we met. So this is where I'm just going to be really open with the public. I have met with everybody. I met with Councillor Weston one-to-one. I've met with everybody bar the two Labour councillors to my left. So therefore, I'm a bit confused with the suggestion that it's not been done. Councillor Weston, I totally hear you. We've had a work in progress with the committee, and we've been talking about this and looking at how we can develop the budget side of things, because we're going to continue to have budgets throughout the year. So we will be looking at it in a slightly different way as we move forward.
Thank you, Chair. Yes, you have met with me, and I'm not saying you haven't, but I think it might be useful for at least next year that we have it with yourself and a budget officer there as well, that we can ask those follow-up questions on. Absolutely. Because they will know everything in the weeds of the budget.
That's fine.
So I would suggest that should happen.
Yeah, good point. And we definitely can do that. So, as far as moving forward today, the decision is, by the Chair, that we will not be looking at the budget in depth, but over the next, following the budget on the 27th of February, we will ensure that all committee members have the opportunity, because we are, just to clarify, I met with the person that sort of administers sort of the minutes for our meetings, our adult social care meetings, and I also met with Health and Wellbeing Board admin, and the plan is that we're trying to see if one of the Thursdays that we have, because we know that we can probably have some tweaks with this, that we kind of utilise some of the spare time we have to offer members briefings, but we just need to discuss when would be a good time, somebody's lunch break, because I know office, some members work. So that is on the agenda. That was, so we are getting to the point where we're looking at where we need to add some more time built in for members to participate in more discussions outside of the committee. And Meta was very, very clear when we had a briefing in a couple of months ago that she really enjoyed meeting all the committee members who were able to be present, and that she'd like us to do a bit more of that. So taking on everybody's opinions and suggestions, we'll be working towards developing a much more inclusive committee so that we all feel that we're part of it and we're not, outside of looking in. So that is definitely being built into this new, into the committee so that we can be more open and honest with each other and more collaborative. So that's where we are. Nothing is off the table, but as far as moving forward today, we'll continue with the agenda as planned. So if there's any more questions under the chair's announcements, I can... Brilliant, so we'll move forward. Thank you very much for your comments, everyone. It's been noted. Okay, so let's move to the next bit. I'm having to change glasses. Right. So agenda item 6 is public forum, and unfortunately we have no public forum questions. So we can move on to agenda item number 7, which is the Adult Social Care Transformation Programme updates. So this report presents an update to the Adult Social Care Committee to provide the progress on the Adult Social Care Transformation Programme called Quarter 2 2024. So Hugh is going to introduce and outline the report because the actual authors, Samantha and Faye, are not currently present. So are you okay to proceed with that?
Fine, thank you. Yes, I can indeed. Well, everybody's had the report. Just by means of a little bit of background. And I do think that, well, I'd like to emphasise at the outset that all of the reports, as often is the case, all of the reports that we're presenting today are interlinked. They all tend to, one way or the other, cover similar ground, and it's all to do with how we as adult social care function are delivering against our statutory duties under the Care Act. That seems to be feeling, oh, you still got yours on there, fair play. Deliver against our statutory duties under the Care Act 2014, which coincidentally was the focus of the CQC inspection that we underwent last week as well. The transformation programme, as you can see in the report, focuses on a few key areas of activity, and it's not surprising that a lot of the budget that we've just kind of touched upon, the upcoming MTFP for 2025-26 and onwards, it concern the similar areas of activity. So we're talking about addressing demand for services, the first bit, working in a strengths-based way, helping people take control of their care and support plans and maintaining their independence, and ensuring that when people receive adult social care, they get the right level of support in the right place at the right time. And a lot of the work we're doing to underpin this is about improving our structures and systems to be as effective as we can be. There's a big theme of work that I know that you know about because we've mentioned it before around target operating model, which is a major component of that and is a key factor in our transformational objectives upcoming. The second area is about improving the supply of local care services. Actually, I'll just tap one more thing back. The demand for services and the target operating model also covers the work that we've done on workforce and the activity that we've undertaken in recent times to ensure that we've got a sufficient workforce to meet our needs, and there's recently been some excellent work. I think she's probably noted, Councillor Clark, that you've got a hand up. some excellent work to appraise our social work and OT, our social work and OT roles, and as a product of that, a regrading has taken place, and we're now, I think, and Meta might talk about this later on, overcoming the workforce crisis that we've had for the last couple or 3 years. The second bit is about improving the supply of local care services to meet people's needs, and we've got a new single commissioning framework, and the main thrust of that activity is to ensure that we can buy care and support for people at a fair price. We favour local services for people. We want to develop and ensure that there are readily available services for people in their communities, in their localities, preferably in their own homes, especially those that enable them to live independently in the longer term. And we're helping the market to build service capacity in the city so that when we spend money on care and support, we create employment, skills and capability within the city. We're also working to develop housing that is flexible and capable of specialised supported housing that supports people with very high levels of need, but also to better use general needs housing in order that people who have got the ability to live in mainstream accommodation to actually have the chance to do that rather than live in institutional care. As part of improving supply, we're also proposing to review in-house services, and I think there's been some of that in the ongoing transformation programme, and there's also some of that in the budget. And then the other bit, which is featured in here, is working with key partners, especially working with the NHS, to make sure that our joint systems work as well as we can and that we fairly share the cost of things that we fund jointly. Now, you'll see in the report that there are, aside from mention of the CQC thing, this is unfortunately a Q2 report because we have to work, we're behind with the reporting cycle means that Q2 finishes and then it takes a period of time to get to committee. So it does mention the upcoming CQC inspection. Well, we've had that now, but contextually that was what was happening at the time. But you'll see that there's been some key deliverables that we were claiming at the end of Q2 to date, and I can update on a couple of those. The first one we delivered just under 1,850,000 in 23-24. That was in the transformation programme. There were other savings that we delivered that were outside of the programme. That the programme secured 4.1 million savings up until the end of September, so for the first 2 quarters of the year. But actually, we've achieved significantly more than that now, and we're on target to achieve the full savings that we said that we would by the end of the financial year. You'll see point 3 about the care management workforce salaries being reviewed, which has been very positive, enabling us to, we think, recruit more effectively and retain staff better. We've undertaken a programme of work around transitions to adulthood. It's a key area of difficulty when people receive services in childhood and then transition into adulthood, and so there's a major theme of activity that's going on there, and I think Meta might want to report back shortly some of the work that we've done under the transformation programme in order to prepare ourselves in order to right position our activity and to be effective, but also to prepare ourselves for the CQC inspection in regard to waiting well and the way that we're managing our systems of care assessment and review. So you'll see that there are a couple of decisions coming up in regard to the target operating model, which I'd mentioned, and potential future decisions about transformation work and the work that will ensue from the upcoming budget. But the long and short of it, I think, is that the transformation programme is working effectively. As I said, it will deliver against its financial savings this year. And as importantly for me, it's helping us to deliver a social services function that is efficient, that delivers effectively for the people that need services in the ways that best suit their needs and is safe.
Okay. Do that all the time. Thank you for the presentation, Hugh. So I note I note that Councillor Clark had her hand up. Does anybody else have any want to ask any questions? Councillor White and Councillor Blake. Okay. So if we start with Councillor Clark.
Yeah, thank you very much. Just a couple of questions, really. There's a budget line for council this next month about continuing healthcare, so working in partnership with the NHS to make sure that we're claiming that funding from the NHS rather than footing that bill ourselves. I'd like a little bit more understanding of whether that's going to require more staff or working slightly differently. And my second question is around any transformation. You need to take your clients and your client group with you. And I just wondered what your working relationship was around this particular project with the Disability Equalities Commission, i.e. Alan Davis, and what conversations you're having with them. So those are my two questions. Thank you.
Sorry, do you mind just repeating the second question, Councillor Clark? Sorry.
You weren't concentrating, were you?
I was.
You were. Well, basically, in summary, any transformation, any change, we need to take our service users with us on that journey. And I just wanted to unpack a little bit about any conversations and working you're having with the Disability Equalities Commission and how that's going. Thank you.
Sorry, I'm looking to Meta because we can do this between us and it will save you hearing the same voice all the time. So I don't know, do you want to go for the CHC one to start with? Is that okay? Thanks, Meta.
All right, thank you for that question, Councillor Clark. So as far as continuing healthcare is concerned, you'll know that that comes with very strict criteria laid out nationally. And the work that we're doing is to try to make sure that we establish and identify people who might be eligible. So the language that I would use is very much about rights and equalities, because it's about identifying those people who have a right to continuing healthcare and to supporting people to get that, because of course it has real consequences for individuals. You may be aware that continuing healthcare is provided by the NHS and therefore is not chargeable. So if somebody is not identified who might be eligible for CHC, it has real ramifications for their lives. We are repurposing vacancies within our system to do that work, to boost the resources that we have, to do more proactive work to identify people who might be eligible. Does that help answer your question?
Yes. And in regard to the involvement of the Disability Equality Commission, I'm happy to say that we have got a very good ongoing working relationship with Alan Davis and the Commission. At the moment, they are engaged in the meeting needs work, which is a conversation involving quite a lot of... I'm not going to say the way that it's been described, because it's not an inquiry, but it's been set up like one. So it's basically witnesses have been called in, the different participants have had an opportunity to bring witnesses in, and conversation has taken place in regard to the seemingly intractable problem that we continue to have nationally, not only in Bristol, in regard to the funding of adult social care, and how to ensure that we're fair and that we apportion funding according to need as it presents. So that has been a very positive piece of work. It's due to report, I think, and it will report to this committee. Is it in April, May? It's at the beginning, in the first quarter. Do you know, Meta?
Yes, so I happen to be a member of the Meeting Needs group, so I have the pleasure of hearing from a great number of witnesses as part of that team, so I have to sort of take my director hat off as I do that duty. I think we have our last evidence session actually at the end of this month, and then there will be a series of meetings for the group to try and bring together everything that we've heard over what is now an extensive number of months. And to work through what might become summaries, themes and potential recommendations for the committee, which I don't think is due to report until the summer, because that process will take time.
No?
Okay, Chair, thank you. And just the other bit is that we have, as a product of work that's broadly under the same umbrella, produced, as you know, a co-production strategy, which is pretty innovative, really. I don't know, there's no other place in the Southwest that's got a co-produced co-production strategy, and nationally, I think it is. You know, I'm not sure that I've heard of any others exactly like ours. Sorry, it's a policy, but that policy does lay out for people who are working on transformational work or policy development or any other aspects of activity that will be about, you know, moving forward or driving change. It does give them a kind of a toolbox for how to address co-production or co-design or more meaningful engagement than the standard processes of consultation and engagement. That piece of work it took a good period of time to develop. The co-production group, one of the first rules that was established was that, you know, you work at the pace of the group, and that if it's to be meaningful, the group needs to dictate the terms and all of that. But actually, we have come out with a pretty it's a pretty robust piece of work that I think people like, and it'll be applied, you know, at the outset of policy thinking across all of our activity. Varying levels of application. Some things won't require a full co-productive approach, others might have one. We're looking also for other parts of the council to be considering co-production in that way when they engage in policy development as well. So lots of good work and really positive, so thank you for that question.
Okay, so Councillor White?
Yeah, in past meetings we've talked about the commissioning framework, which is great, but there were also some issues raised about some people being pushed out of the market. And even when I spoke to Richard Hills then, saying, yeah, we perhaps need to tweak it a little bit to get it absolutely right, to get the right number of providers and not, you know, shut too many people out of the market. I just wondered how that was going.
Pushing and shoving aren't the terms that I'd choose, Councillor Y. Yes, but yes, we are working through internally with legal and procurement colleagues the means by which we're going to ensure that the way we let work through our single commissioning framework is fair and also ensures sufficient coverage from a range of different organisations to make our services safe. If we vest all of our activity in one provider, then that provider, if that provider has problems, then we've got problems. So we need to make sure that there's a fair spread across the localities. We're working on a locality basis. That said, we are in the position, I'll emphasise it again, I said it last time, we are in the position where there are 140 providers who are domiciliary care providers, home care providers in Bristol. That's more than we have work for. So the basic practical reality of that is that we won't be able to give work to all of the domiciliary care providers who might want it.
I think we understood that, but there's 140 is obviously wrong, but 2 is also wrong, so getting that balance was quite important, and you put it much more eloquently than me.
Councillor Blake.
Yeah, a couple of questions. I think the last time I raised about the transformation programme, we said about how much have we spent against it. I don't think I I don't think it's picked up on in this report about, you know, where are we in terms of spend against the actual transformation budget. I may have missed that, but I didn't think I see it. If it could be corrected for next time, that'd be great. When the other question I had was related to target operating model and the extent of that work, because the meeting needs stuff came out of the affordable care policy discussion. How can we afford, you know, this increasing costs around providing care, and there's some concern around the fallout of that policy, particularly for people with high care costs, and then the sort of talk about residential stuff. So the meeting needs group was about actually trying to assess this, or try to square the circle between getting care right and it being affordable, right, essentially. But how does that relate to the target operating model, though, Hugh, that we're implementing and actually getting our costs down? You made reference to it already a little bit, which is really helpful. But so I just want to know what those relationships are, really, a bit more information about how those two things can coexist. And then I've got a final quick question about we talk about RPI in the paper for some of our providers, inflationary costs, and I thought the sort of measure we use now should be CPI. I wonder why we use our IPI. Is it more relevant? It's a genuine question. I don't know the answer to that.
Okay, so I'll get Hugh to answer the last question first, because it seemed like it's a straightforward answer, hopefully. And then Meta will answer the issue about target operation model.
I might have to get back to you unless any councillors who may have been involved in commissioning before can give us the definitional difference between the two. I think one includes all house prices and things, doesn't it? I think that's the CPI bit, and the RPI bit doesn't. But please don't quote me on that. I'll get back to you with a written response and then make sure everybody has it. I don't know whether we might invite any councillors.
I can't remember not using RPI, to be honest. In my
RPI as far as I'm concerned.
It doesn't exactly answer the question, I know.
Although CPI may give you a more, if that is the differentiation, CPI may give you a more realistic perspective on what is particularly Bristol in regard to the house market and things. But please don't quote me, because I'm not an expert. I'll get back to you.
Yeah, it could be the other way around, actually, RPI. So I look forward to the response.
We'll note that.
I think the point I was going to make is it hasn't changed to fudge things. It's always been used.
Okay, we'll make a note of that and make sure that we get a proper... would you like an email, or should we just put it in the minutes? Yeah, we'll do that. Thank you, Councillor Blake. Meta, thank you.
Yes, thank you, Councillor Francis. So to tell you about the target operating model work, there's a really, really long answer, and today is probably not for that. But in brief, it relates to an extensive piece of co-design work with our workforce and with our communities to look at the way that particularly the care management element of adult social care, how that works, in an effort to create conditions that bring about better outcomes for people and families, but also where we have a good environment for our workforce, and crucially, where we have an environment in which gives us a better chance of managing the budgetary pressures that we will be probably talking about throughout today's committee meeting. So the way that it relates to the work of the meeting needs group, if I was just to focus on that which would be a very narrow angle, it is about strengthening our workforce and our processes and the way that we practice to make sure that we achieve community-based outcomes for people. So it links directly, because we know that strength-based practice, which is the language that we use around community-based, very personalised outcomes for people, those are more likely to be financially sustainable in the long run as well. So the target operating model seeks to achieve a way of working which is more likely to achieve those community-based, very personalised outcomes for people, to avoid the need for residential care, to avoid people stepping into institutional care sooner than they might otherwise. do. And some of the evidence that the meeting needs group is hearing about is what the evidence is about what Bristol is doing about that, the way that people in residential care and nursing care is reducing, the way that more people are living in communities, and what it is about both how we work with providers and with the market, but also how social workers, OTs and social care practitioners work with individuals and families to find localised solutions to the outcomes that they're seeking. So I hope that begins. It's probably worth us doing a longer session on the work we're doing around the target operating model, because it's a really long piece of work and it will lead to some structural change in due course, but we're not at that stage. And it might be worth knowing that it started with a vision for adult social care, which was a co-produced piece of work, which now guides how we go forward. So, but really that's the connection with what the Meeting Needs Group are doing, is that it's one of the elements that go into achieving the outcomes that the Meeting Needs Group is seeking. And in fact, I'm giving evidence to the Meeting Needs Group this week about the target operating model. So it's a good question. It'll enable me to practice my response, I think.
Okay, so sorry, need to put my teeth in today. Has everybody had any questions they need answered, or do they have further questions? Councillor Johnson.
Yeah, just a quick question, just about the statement that was made about us having 140 domiciliary homes in excess that we're not using. And I just wondered what thoughts have been given to sharing resources with children's social care, because they consistently report a lack of resources in that area.
Okay. Yeah. Thanks, Chair. Yes, there's 140 domiciliary, as in home care providers. So there's 140 organisations that are providing home care. That means that when they go into people's homes and deliver the care, they're registered to deliver home care for adults. So their registration is, for adults. They may want to diversify into providing care for children's. I don't think there's a shortage in the market for children's domiciliary care either, to be fair. But as it stands, they are adult domiciliary care providers, so that will tend to be what they do. And we've got more than Bristol City Council needs. There are other ways that people get care in Bristol than just through the council, so people can buy their own domiciliary care if they fund themselves, for example.
Yeah, it's just, I guess what I'd like to do then is to challenge that thought process. I work in a children's with disabilities team, and I can tell you hand on heart that we're consistently struggling across the southwest to find domiciliary support. And I don't know whether that means thinking about the people that we're training, whether they're trained for both adults and children, so that we're not in the situation where we've got over what we need in the adult section and under in the children's. I'm just thinking about a different way of thinking moving forward.
It's a fair point. I think the conversation perhaps should be taken forward with perhaps Gail Rogers, Hannah Gillett, who are the children's commissioners. And if there is a shortfall in children's domiciliary care, I'm sorry, I thought it would. I assumed that there wasn't. I've not heard that there is. But if there is, then perhaps they should have conversations with some of the care providers. We can let them know who they are, and maybe they can look to diversify into, especially those that perhaps support people with complex needs and disabilities. Maybe they could look to diversify more into children's care. It's good suggestion.
Sorry. Thank you. Question, Councillor White.
Just another thing. One of the things I do is I help home care agencies write tenders, and I've seen a few recently where they're actually asking commissioners. Newham's an example; it's live at the moment. Are asking for dual registered home care providers for exactly that point, and to help with transitions. So I just throw that in there.
That's good. Did you say Newham? Well, you see, a previous children's director in Bristol City Council then went on to become the chief exec of Newham, as you probably know.
So, really good point. I think we'll put the names in the minutes, and if you need to double check them, we can always get you to give you the names. But really good idea, actually. And it obviously sounds as though it is achievable. So, yeah, good idea. Okay, so let us move on. Right, let me change my glasses. Oops. Okay, right, so thank you all for your questions, really useful questions. So, that the committee knows that the report states that Adult Social Care Fund has a saving target of 10.9 million in this financial year. The programme continues to work on additional initiatives that contribute to the delivery of this. Point 2, the report states that as per baseline at CLB, which is the Corporate Leadership Board, on 26th of April 2024, the Adult Social Care Transformation Programme budget is 2,432,000. That's correct, isn't it? Is that some there? Yeah, 2 million plus. 2 point, just short of 2.5 million, plus contingency held against the CLB. That point 3, the report states that as per baselining of at CLB, the Adult Social Care Transformation Programme saving target is just short of 6.5 million. And point 4, as per baselining at CLB on the 26th of April 2024, no funding has yet been approved for 25-26. So this relates to the previous period. Okay, so I ask that the committee note the report as per the recommendation set out. So thank you very much. So let's move on to the next agenda item 8, which is P8 Finance Outrun Report. So this report presents a brief update to the Adult Social Care Committee on the Council's financial performance against the approved budget and its forecast use of resources for the financial year 24-25. So this is the last 12 months, okay? September period 8 extrapolated. There are no decisions to be taken on this report, which is for noting. So I'd like to invite Hugh to introduce and outline the report. So obviously Denise Hunt is unfortunately not able to be present. Okay, thank you.
Thank you, Councillor Francis. Yes, so I'm afraid you got me again for this. Yes, you've got the report. I think the key headline from that report, and bearing in mind it is period 8, which takes us up, I think, to the end of November, is that there was no change beyond period 7, although there's some fluctuation within the activity within the budget. So no change reflects outturn projected overspend at the end of the financial year of just shy of £7.8 million on a budget of around £200 million, or about 3.5%. So I think if you look on the page 28, the summary period 8 movement bit, it's quite interesting to note that we did see another decrease in the purchasing budget overspend associated with care packages and support, which I'm happy to say has likely come as a product of the spend control mechanisms that we've put in place in order to govern spend and to look to ensure that the work that we do, committing resource to meet people's needs, meets them in an as effective and efficient way as possible. You'll note the accounting adjustment element of 0.6 million, which basically is accounting for savings that are not likely to be met by the end of the financial year, so that by the time we get to the end of the financial year, all of the savings will have been encompassed, and we won't be projecting additional overspend as a product of them. And you'll see a slight an increase in employee costs of £500,000, with a projected underspend now at 0.9 million for employees. So I can say that period 9, we are now showing another slight improvement on the position. I think at period 9, we're seeing a projected overspend of around 7.1 million. So we have, I think, taken probably 670,000 off the projected overspend since this period 8 budget, with the outturn from period 9, which takes us to the end of December. So I would like to posit, backing up what I think I said in the last meeting, that the work we have in place is slowly but meaningfully addressing our perennial overspend. So we are going to be seeing that come down in upcoming months. I've always said that the transformational work, with which this is obviously directly linked, is never, it's never very robust if it's trying to do everything too quickly. What we're seeing here is a measured approach that is producing measured but beneficial results that in the long term will achieve the goals that we've set for ourselves. Thank you.
So, thank you for the presentation, Newt. So do we have any questions in regards to this item? Okay, Councillor Wyve, and followed by Councillor Weston. So Councillor Weston, if you just jump in as soon as Councillor Wyve stops speaking.
Yeah, no, I just thinking that the next period we're heading into winter proper, and we know that the NHS has been under pressure, and we know that often has a knock-on on us. So I just wondered about how confident we were of weathering the winter weather.
Yeah, through you. It's never totally stable and safe in regard to budgets over the winter period, although I would like to say that it is safe in regard to our practice and the way that we support people. That said, we have, as you've seen in prior committees, organised our discharge grant in order to create capacity within our discharge part of the system to support people out of hospital and back home effectively. We've quite significantly increased our capacity at the point of discharge through the transfer of care hubs, which Meta might expand upon a little bit if people are interested. And also we've improved our productivity through our reablement service to ensure that that's much more able to pick people up as they step down out of hospital and back home. We are working to improve our throughput so that people are getting their assessments more quickly as they step out of hospital into longer term services, bearing in mind that the overall objective is discharge to assess, so people shouldn't be assessed in hospital in a point of crisis, but should be assessed when they're more stable in another situation. And I think quite importantly, something that's been very successful for us, but it's already budgeted for, so in the context of finance, it's already kind of encompassed within this, is bridging domiciliary care, bridging home care, which we've got quite a lot of capacity in the 3 localities of block purchased home care that is used to ensure that people who are stepping down don't step down into beds when they don't need to. They can step down back home with bridging home care or reablement and then bridging home care pending an assessment to ensure they get the services that they need. So I think we've learnt quite a lot from prior years. 22-23, when the system was much less stable, I think that ended up with us placing more people in domiciliary, in residential and nursing care contexts. And I think this year we won't be doing that because we've got more wrapped around the system to ensure that people don't have to. And I think Meta can, I don't know whether you do want to expand on this, but our general trajectory is good in regard to residential and nursing care placements.
Yeah, I wasn't going to add much to that other than to say we really invested in the care management part of that to make sure that waiting times for allocation, which is just one of those technical bits to get people seen as quickly as possible. As of last week, we were able to tell the CQC that there was nobody waiting for allocation who was ready for discharge. So that's a really big achievement. There's still a long process after that because things take time. You have to carefully deal with people's mental capacity and their understanding about their care and support. Supporting people out of hospital is a system issue. It's not just a social care issue. There's all sorts of things that need to be in place at the same time. And we've set up really careful metrics to make sure that we can measure the effectiveness of our care management function in the hospitals. And progress is being made really well at the moment.
Thank you, Meta.
Thank you. A couple of quick questions, if I may. Looking at Table 1, page 28. Now, I say that with trepidation because often the reports don't seem to match depending on where you're reading the report from. This is looking at the adult social care outturn to P08 forecast. And it struck me two figures, and I'd like to ask a question on both. The preparing for adulthood figure actually has us projected to be below the budget, which seems strange because in virtually every other budget line, we're exceeding the budget. What happened in that budget line that puts it as the outlier?
I think that month by month, things vary as a product of process. Yeah, I know it is.
12% less.
Yeah, I know it is, but I don't think it's like that every month. And I think that, so what we'll see purchasing wise in period 9 is quite a lot come through because we have had that it's about how quickly they're processed through the system. People are getting the care and support, but it's how quickly they're processed and then on the system and then featured in the report. So I suspect, and I may be wrong and I will check and get back to you, I suspect that's an aberration just for this month because that has gone up in other months. I think Meta is now going to clarify. Is that right?
Is anyone else watching the hospital passes go from Hugh to Meta in this?
No, I was going to just make an observation. So you may remember sitting in committee previously hearing about the transition project. It tries to do all sorts of things, but one of the things that it tries to do is to get better at the data. That means that we can predict who's coming. There is something which I find quite curious about the way the budget is set up here in Bristol, which is that the transition team even has a budget of its own, because really it's a team that supports people for a shorter period, and then they go back to be looked after by the locality teams. And so I'm used to that budget sitting in the locality teams, where you wouldn't get this kind of movement through. So I would like to think that in future years we will be able to be much more precise about exactly who are the young people who will be hitting the books, if you like, during that financial year. That said, there's a lot that we can't predict. It's always going to be an informed view about what the costs are going to be associated with that young person. And of course, we work harder and harder all the time to make sure that we find local solutions and that we challenge the costs that sometimes we receive from the placements that have been made through necessity by our children's colleagues. So, that it's a transitional budget, and therefore, in and of itself, it's always going to be a strangely variable feast. But also that our data is improving, so that when we do budget setting for next year, we can look at the spreadsheet and say these young people are known to us, and it's a reasonable estimation, therefore, when we estimate how the budget sits. But there is an interaction between the locality budget and the transition budget, where you've got people moving in and out.
Thank you, Chair. Sorry, one more from me. Normally when we're looking at budgets, when add social care, we're looking at the overspend. We always look at the overspend and how the council's going to get it back within limits. One of the things certainly I rarely ask question is actually below that. It's the income, the service user contribution. Actually, I could stand with learning a little bit more as to how we raise that money, what the eligibility is, how do we pursue that? Are we maximising our income that people are? Because obviously those that can afford it do pay. I personally, maybe offline to this meeting, would like to learn a little bit more about what we do with that to make sure that actually we're maximising our income in order to meet our obligations out.
Happy to have an offline conversation as well. We have been doing a lot of work on this recently, and the benefits you'll see in the budget the budget projections. We have had a little bit of a backlog of reviews of financial assessments, and we've been working through them. And in doing so, we've managed to secure a more up-to-date amount of contribution from people who are eligible for services but are also able to pay for some or all of those services. As I'm sure you know, the amount that people pay depends on their ability to pay, which is determined by how much money they've got. If they've got more than, I think, 23,000 or something along those lines, then that means they have to pay some, and it goes on a sliding scale up until a ceiling limit, after which they have to pay the full cost.
So, good question again. So what we can do is we can have a whole committee briefing on that as well.
I'd appreciate it, thank you. I mean, it might be that everyone else knows and I don't, at which point I've asked a stupid question,
I'm sure
but I would like to learn a bit more.
Fabulous, no problem at all. Is it a quick question, Councillor White? Okay.
It's been 23,000 for a very long time. Is that going to increase at all? And I think that's nationally set, isn't it? In memory.
Yeah, I think it is nationally set, and it has ever since I can remember been 23,000, which, given the recent inflationary issues nationally, will mean that poorer people will have to pay a little bit beyond that. I don't think it's been subject to inflation. Again, if we have an offline briefing, we can explore that more fully.
Excellent. So, is there any more questions? Because we are... Go on.
Sorry.
All right.
Yeah, just in terms of data, I'm just wondering what the qualitative cost is with us reducing or getting back into budget from our point of view and versus the service users' point of view as well. I don't know if we're even thinking about collecting that kind of data, but if we're not, I think we should.
Is that in relation to the financial assessments?
Yeah.
I mean...
Is the question, do you mind? Is it
no,
okay?
You go.
Yeah, if you turn yours off, and I won't start howling with feedback. Are you saying what effect does it have on people that use services for
on
us to...
On the quality of the service that they're receiving, because obviously it's within our remit to get the budget as it should be.
Yeah.
What is the knock-on impact of that for a service user? And that is because we're talking at the moment about the quantitative, and I'm asking about the qualitative aspects of that care from our point of view and also versus the service user's point of view.
That is a very good and quite difficult question, but I'm happy to try and answer it. We do quite a lot. Right, number one is more I've got to make it brief, Carol.
Okay, sorry, let me interrupt a minute. Carol, can we come back to that question in a minute? We will make sure we answer you.
No, I'd like
after
an
our
answer
break.
now. No, I'm joking.
No. So we're going to...
Are we going to answer after the break? Because I've got an answer for you. I have, honestly.
Go on and get up on your answer.
No, right, thank you.
Right, so we're going to have a quick convenience break. Thank you. 5 minutes, please, so please don't wander off. Sorry, and... on to, oh, no, Councillor, sorry, not Councillor. She was going to answer the question.
Thanks. Yeah, it's a couple of points, really. I suppose the first one I'd want to make is that the most expensive way of meeting a need isn't automatically the best way. In fact, quite often, if there aren't sufficient services of the right kind to meet someone's need in the right way, services get more expensive. You overcompensate because of being risk averse or whatever. And so in that regard, I think that some of the main things that we're trying to do to meet need within better, budget in a way that's better for the budget is to do the right thing first time, every time. And that there's two sides to that. There's the bit about care management and the work that we do around there, and a lot of the work that's going on, and even more so that will be going on as we develop and implement our target operating model, is very much about that right service, the right response first time, every time. And also about being strengths-based, which is, well, I'm sure you know because you're in the field, but strengths-based is about working to ensure that, the assets that people have, the capabilities they have are built upon in order to meet their needs in the way that suits them the best. It's much more expensive for someone to go in a care home bed, but no one really wants that. They want to be living at home and enjoying the benefits of their communities and their friendships and all of that. So there's a lot more of that going on. The second bit is about making sure that the services that we buy are sufficiently diverse to be able to do that. And that's a work in progress. There'll always be examples where, there aren't the right supports available to help somebody. But if we work on that and develop as we go, we will get more cost-effective services, more local to people that meet their needs. Then the last bit, I think, is that we and I know all this because of the CQC last week, because we did a lot of, you're getting all the benefit of our exam last week. But we are actually very adept at quality assurance. So we do a lot of work, firstly, within our services. Netta runs a whole mechanism of ensuring with her principal social worker that the work that goes on within our directorate is of good quality and meets people's needs the first time and every time, and can show how we improve when we do that. Also within our commissioning side of things, we have a quality assurance team who ensure that the services that we buy are of sufficient quality or good quality. And as we always say, unusually in Bristol, 95% of the CQC registered services that we buy are either good or outstanding, and the national average for that is about 83%. So there's a lot of ways in which we're assured that what we're doing is the right thing and we're doing it in the right way. And just, to hold on to the fact that sometimes, we can pay too much for something that isn't as good, and we can do things more cost effectively in a manner that's better for people and that they prefer.
So I hope that answered your question. And and to add a little bit to that as just a final point to that, I'm out visiting social work teams and speaking to practitioners as well. So they're giving feedback as well. So that's really useful for me. Okay, so let's move on, to just end this section. So point 1, the Adult Social Care General Fund forecasts outrun revenue position of 7.8 million overspend at period 8, which is 24 to 25 period. And point 2, the forecast of a break-even position on the capital programme budget 2024 to 25. So we're just asking committee to note the report as per recommendation. Okay, let's move on to agenda item number 9, which is the Corporate Risk Management Report 24 to 25. So this report provides an update on current significant strategic risks relevant to the Adult Social Care Committee. The risks relate to achieving objectives set out set in the Council's corporate strategy 22 to 27, and the report summarises progress in managing the risks and actions being taken as at Q3 2024 to 25. So again, there is no decisions to be taken on this report, which is for noting, and I'll invite Meta to introduce and outline the report. Thank you.
Thank you, Councillor Francis. So as Councillor Francis outlined, this report is about significant and strategic risks. And I was just going to give you a little bit of background about how our risk register works. So the first thing to say is that this is reporting on Q3, and also to say to you that it's a dynamic situation. So for every quarterly report that you get, you will notice that risks have either been increased in grade or decreased, or perhaps even removed from the risk register. We renew it on a quarterly basis, and we review it in between that as well. The risks that are on this report, therefore, are strategic and significant risks. So those are the risks that have reached over the level that we call them a corporate risks. That doesn't mean that, therefore, that it is the only risks that adult social care has on their risk register, but they are the three risks that fall at the level that means that they are reported here today. And I think that's really important. The three risks that are highlighted, therefore, in this report are first of all, CRR51, which is around financial sustainability of adult social care, and our ability, therefore, of meeting our statutory duties under the Care Act. There has been plenty of conversation already today about the financial situation and the pressures that we're experiencing, the increase in demand, and so on. So this is a persistent and present situation for us. There are two others on here. One relates to safeguarding. Now, safeguarding and our ability to meet our duties under the Care Act, I think, falls within three different factors. One is increased demand, and we were able to evidence year-on-year increased demand in relation to referrals for safeguarding. One is having had a reduced workforce, and we've talked already today about workforce. So you've got the multiples of increased demand and a reduced workforce. What you then get is an inability to manage the risks sufficiently well. And then the third factor in managing safeguarding is around how well the system works. So whether we are being as effective and efficient with our resources as we possibly can. This risk we're managing very dynamically. You will have heard earlier about workforce. We have managed to stabilise workforce. We do still have vacancies, but we've made significant inroads into stabilising the workforce. We have also done some temporary changes to our system and process, which means we've developed a small safeguarding hub that reaches into our locality teams and basically follow the risks, so where there are the greatest amount of referrals. We have also, over the last few months, instigated what we call a multi-agency safeguarding hub, MASH for short, which is helping us screen and manage multiple referrals around the same person, particularly where somebody is experiencing multiple disadvantage. Very dynamic. I would like to think that because we're making progress on at least two out of those three elements, that actually we will be able to reduce the risk so that you don't see it on the next risk report, but we will take that view in due course. The final one on here, again, it's been mentioned already today, is Care Quality Commission assurance, both preparedness and rating. And I was very careful to name it both preparedness, but also the eventual rating. Well, I can say for sure that our preparedness in the end was very good. We delivered our on-site inspection last week. Everything fell into place. Our teams were really well prepared. Our partners were really well prepared, and the inspection process ran well. But of course, this report relates to last quarter. As for the rating, we wait and see. Also, when we come to review this risk before the end of Q4, we will know the outcome of our inspection, and so this risk we will take presumably a different view of by the time we come to review. But there will be other risks which we are currently considering, which may appear on the risk register in Q4, including ones under consideration at the moment is deprivation of liberty safeguards, where we have created a risk which will appear on our departmental risk register next time around, not yet at corporate level, but also we have very significant concerns around provider sustainability. You will know about the rise in national insurance and what that means for our provider market and therefore for our ability to support those providers with those pressures. There are plans at the moment to raise a new risk on the risk register, which may or may not appear at corporate level the next time you see the report. So I hope that gives you an overview of not only what's on there, but also how we work dynamically with our risk register.
Get a bit relaxed there. I was like, okay, thanks, Meta. So, no, not at all. Councillor, over to you, Councillor Martin.
Thanks, Meta. Nice rosy question. So I can see we're, we're in the high risk for those three. Can you say a bit more about the details of what it looks like to enter into the critical risk and how you know we're there?
So if I, so the one that I talked in more depth about, which is because it's my comfort zone probably, which is the safeguarding one. Hugh referred earlier to our quality assurance framework, which is fed by both numerical data. So I have to hand on a daily basis information about how many people are waiting in terms of the triaging of the assessment or the triaging of the referral, decision making around whether or not an inquiry is required around somebody's safety, and whether or not we've been prompt in putting a safeguarding action plan together. So I have data that allows me to track that on a daily basis, and I therefore will be able to see whether or not we're meeting the standards that we would expect in order to keep the system safe. We also have qualitative data, so we do listening audits and thematic audits around safeguarding. So we will be talking to people who we have had a period of intervention with around safeguarding, so that we know qualitatively how the system is working for them and whether or not the intervention was positive for them. We bring that information together in what we call our quality assurance and performance board, so that we are constantly on top of where we are. And it is a professional judgment. There isn't a number, I would say, where that's okay or that's not okay. So ultimately, it's a professional judgment that goes in from an operational perspective as to when we think we don't have sufficient sight of the risk, or that we have evidence that our interventions are not timely enough and that that's adding to the risk that people are experiencing. We do within our referrals, there will always be people waiting, but the important thing is that we're able to prioritise, and that we're able to prioritise using real-time information about what people are experiencing. And for some people, it will be an acute risk, and we will respond immediately to that. And for others, it'll be more long-term and intractable issues that therefore effectively is okay to wait. And if I cross that line that I think we have an unacceptable level of wait that causes risk, that's when it gets to this level.
Just a quick follow-up. So you said about how we're stabilised at that position right now, and did you say that we're hoping to move out at the next quarter or two?
Yes, so the fact that I can tell you as of today that in the last 6 months we have reduced the number of safeguarding. I'm going to be a bit technical in the system, it's called safeguarding tasks. We have reduced numbers of tasks waiting for our attention by almost 50% over the last 6 months. So what that tells me is that my team has got a good trajectory, and that we're getting on top of it. That, combined with stabilising the workforce, means that I can be reasonably confident, can never be certain, but I can be reasonably confident that the progress that we have made will continue to bed in. So my trajectory is going in the right direction, which is why I'm saying I would hope that either in the next review or the one after that we can be more confident about reducing it to a departmental level, which means it would then disappear off your report. I think safeguarding particularly, now we've hit on this particular one, you wouldn't want anyone to ever not be safe. And so you will also notice from the report that our acceptance thresholds, so the level at which we accept the risk is really low for this one. There will be other risks where we accept a higher threshold. For safeguarding, our threshold will always be really low.
Thank you, Councillor Martin. Okay, Councillor Clark.
Thank you. I just wanted to ask a little bit more about the multi-agency approach with referrals that you're getting from a number of sources. Can you sort of unpack that just a little bit about that working practice?
Yes. So if I was to take you back to just saying that I was using the word task, that's how it sits within our data system. What that means in reality is that you might get 2 or 3 or 4 safeguarding referrals for the same individual, perhaps for the same issue, but perhaps for different issues. So you might get one from the ambulance service, you might get a referral from the hospital, you might get a referral from the drug service, for instance. They will look on the system as 3 or 4 different individual tasks. They're actually one person and one issue. And that all takes quite careful triage. At the moment, or rather not at the moment, previous to the multi-agency safeguarding hub, we would be sitting as a sole agency, looking at that, working our way through each one, trying to connect with other agencies around whether or not there are other safety planning interventions underway. What we will be doing now in the multi-agency safeguarding hub is sitting around the table, mostly virtual table, with AWP, our mental health provider, with the ICB, with other agencies, probation, whoever it is. We'll be sitting around the table and we will be talking about those individuals, particularly those individuals who are experiencing multiple disadvantage, and particularly those people who are experiencing self-neglect, because actually those are the ones that cause a great deal of worry amongst our agencies, quite rightly, but also where it takes a team intervention to make sure that we help people to be safe. The MASH will help us both reduce the anxiety around that by agencies, which we hope over time will reduce the number of referrals that we get, because the system will understand that we have an active management plan in place, which will then stop the ambulance service, flicking in another referral every time they've been to a site to intervene. I hope that helps.
So really the question is around outcomes. Have you actually got any data around outcomes for those individuals and also for the services? Because, as you say, an awful lot of time is being taken by a range of agencies on one individual. So can you kind of explain that a little bit, unpack that a bit, please?
So the multi-agency safeguarding hub only started in November, which means that collecting information and evaluating outcomes is probably a bit too early. But that is what we would aim to see, whether the impact over time, for instance, on our people waiting referrals and individual outcomes. I think we probably have the right mechanisms in place to be able to do that evaluation, but we will need to give it more time before we do that.
Okay, has anybody got any more questions for Meta? Excellent. Okay, thank you very much for that. So, so there's no, as I said, there's no decision to be taken. So for the clarity for the committee and the benefits of everyone in the room, that the Adult Social Care Committee note this report. Okay, so we've noted the report, okay. So agenda item 10, we're going to move on to the quarterly performance report, quarter 2, 20th, 2024 to 25. This report is to brief the Adult Social Care Committee on performance against Bristol City Council business plan as relevant to the remit of this committee for quarter 2, and for members to note areas of specific interest or concerns with the relevant directorate. There are no decisions to be taken on this report, which is for noting. So we've got a theme today. So I'd like to ask Peter Franklin to introduce and outline the report.
Chair. Hello, I noticed you haven't got a laptop, is that right? Luckily for you, I've got Appendix 2. It's in Pixie font there. Literally just lost the page now for the report. I do apologise. I shall. No. It's the cover report. It's the cover report. I've not got there. But so, as Chair's highlighted, what we've got is the measures up to the 30th September. So you've already seen earlier reports have been at P9, P7. They've been at different stages. This is as at the 30th of September, 2024, and at this point. If you scroll down slightly on your cover report, you'll see a snapshot of our performance dashboard. There it is, thank you. And it highlights the number of measures, actions, and priority metrics, and outcome measures. Now, at the moment, there are no outcome measures because those that are available as outcome measures aren't reported until Q3. So, at Q1, you can see the actions listed. All of them, all bar one, are on target, are on track, and the one that isn't on track relates to the work, I told you it was Pixie font, the work with healthcare partners across the city to make it easier for people to live. As you can see, there's been delays in acquiring the support, and therefore there's been a slippage in that particular action. All the other actions, I say, are on track. The priority metrics, you'll see, the one that does stand out in the colours there, we'll look at when we come to Appendix 2. As I say, there are no outcome measures at Q2. So if you could go to Appendix 2, that would be helpful. And then if colleagues have got any questions relating to any of the actions that I've alluded to, that would be great. And I'll happily do a hospital pass, Councillor Weston. You can see that the one measure there that is bright red is the initial wait time for Care Act assessments. Whilst red is actually a good news story in that the number of people who have had Care Act assessments has improved considerably. But the way the measure is calculated, it means that over a period of 12 months, the actual average is at and remains at around 55 days. Our previous year's outturn was around 61 days, and we set an interim target of 42 days. There's been an awful lot of work in this area. I know that Councillor Blake asked questions of this previously, and I don't know if any colleagues would like to ask any further questions on that. Please do.
I mean, what have you done thus far to make a...
Through the chair, please.
Thank you.
Can I ask a question? So what have you done thus far to make inroads, and what are you going to do to actually improve the situation? Yeah? Fine.
Okay, so first of all, to explain a little bit about the metric, I won't bore you too much with it. You will have heard me say earlier that our waiting times for Care Act assessment has reduced, as it has for safeguarding. Both are on the same trajectory, reduced by between 45 and 50% over the last 6 months. So that's actually really amazing progress by the team. The way this metric is counted is that it's work that was completed over the last 12 months. So not people who are currently waiting, but people whose assessments have completed in the last 12 months. So the more work we do from our waiting list, this metric doesn't improve because we're dealing with people who have been waiting or who had been waiting. So I think when we set the metric, I think it's fair to say I don't think we'd fully understood that that was the interaction between the two. It's still the right target, and we're still going to aim for it, but we won't start making inroads in that until we get our waiting list down to a much, much smaller number, and we're dealing with people in a faster turnaround. So that's just to explain the metric, that actually that's why on as far as if you just go by that number, it doesn't look like a good news story, but actually it is. In terms of what have we done to achieve the progress that we've made, I think there are 2-3 things to highlight. One is stabilising our workforce. We've talked about that already today. Pay just being one of those things. We were having a really high turnover of staff, and of course you can't recruit social workers for love nor money, particularly when you're not paying them enough to pay their mortgages. We've stabilised that. Our turnover for social workers is now near 12%, which is exceptionally good for care management. And we have really low sickness, because I think what we've also done is create a good place to work. So stabilising the workforce goes directly to getting our waiting list down. We have also this year procured some additional support from an external agency, which we have paid by service rather than employing agency social workers. We've employed an organisation which gets paid by the assessment. So they are still professional social workers, they're still making a contribution in the same way, but in order to try and get on top of our backlog, we've had an external contractor help us with that. And then the final thing, I think, is about really knowing our data and being really firm on our performance management. Which means that we've got to focus on these numbers on a daily basis. There is not a day that I don't look at Power BI to see where we're at and check in with teams about the progress that they're making, so that I can analyse the risk and where it sits in our system.
I think Hugh would like to just add something.
No, I mean, Meta's covered it. I just wanted to highlight the point that's made in the narrative, which you alluded to, that the overall number of people waiting for a Care Act assessment reduced by 22% in Q2 last year, and as Meta said, that's increased quite significantly since then. So we're on this. It's a bit perverse that the indicator doesn't reflect it. We'd rather have an indicator that held it up and saying they're getting there, but we are proud of this work. It's been very good.
Yeah.
Sorry,
could I just add to what Hugh said there? Thank you, Chair. Is that because of that way the calculation is, Hugh's absolutely right, but when we come to look at Q3, you won't actually see it anywhere. It won't appear better than the 55 days that we reported it at Q2, because of the reasons we mentioned. We are looking, as Meta said, there's a lot of work going on here. Thank you, Chair.
Thank you. Councillor Wah, you had a question?
Yeah, just very briefly, Meta. I extolled the virtue of clearing the backlog to CQC, you'll be pleased to know, but one thing I often ask is, how do we ensure consistency across our workforce? And I just wondered specifically with them, how do we know they weren't giving out 50 hours when one of our in-house people would have given out 10 hours of dom care? I'm exaggerating, but
Absolutely. So I think there are. I think you were asking about the care package size and solutions for people. So, if I may, I will answer a question you haven't asked me, which is, first of all, the way that we prioritise how people are seen is now standardised across all of our teams. I could have perhaps said that in my answer to Councillor Clark. We have a prioritisation and a tagging methodology on our waiting list, which means that we always know who sits at the highest priority, and therefore the reasons that people get seen sooner or later will be determined by the risk rating that we give. In terms of outcomes for people and the way that we do that, those external workers are still subject to the same scrutiny process, the same level of supervision, the decision-making process, the scrutiny by managers, the same brokerage function, and of course we have case discussion forums and case discussion support options forums, which are the way that we have a multidisciplinary team that comes together to help make decisions about about outcomes for people, and those processes are still in place around those cases. So they are subject to all of the same scrutiny and all of the same processes as those operated by our own staff.
Thank you. Thanks, Meta. Peter, do you want to carry on?
Thank you, Chair. Yeah, so scrolling down the page, you can see there's an orange, but I would just point out to colleagues, this is very linear. As you can see, the target's 3, and we've hit 3.1, so that is below target. That is below target. When it goes red, is a matter of discussion with the director and myself about at what point should alarm bells ring, and as you've seen on the previous one, it went red. The next one's green, which is very, very good. And then over the page, I think it was yourself, Councillor Y, you asked for some information around, it's all well and good seeing the numbers, but where are they, you said. So on this occasion, I've listed, line by line, where those people are, and the numbers in each type of care. I'm not sure it will help you, and it won't add up to the numbers, just for information, because sometimes a person has more than one of those services. Okay. Can I ask, Chair, through you, Chair, do you still need that level of detail at each of the Q3 and Q4? Otherwise, just be reassured that we do have that and can provide it at any given time. You like it? Okay. No. Not for me anyway. No, it's fine. Thank you. And then could you scroll down the page, please? Thank you, Bronwyn. We've got some bright greens, which we're doing well on, and then you can see the very bottom one. That's the outcome measure I was alluding to, where we'll have that information. I did say Q3, but actually, I'm going to look at Councillor Clark because you nodded at me when I said it. It's actually Q4 that one's being available because it's being carried out now in Q3, if that makes sense. Yeah. No, in Q4. So then the last 3 items, whilst they're under the remit of this policy committee, they actually sit within the Growth and Regeneration Directorate. And as you can see, they're mainly around reablement, tech care, and they're all green. So overall, as it stands from a performance point of view, and bear in mind I'm independent, I work within the Resources Directorate, I hold the mirror up to Meta and Hugh. It's a really good position that they're in, and if you've got any further questions, please, I'm quite happy to take them.
Seems like everyone's happy. Oh, I thought she was putting his hand. Thank you, Peter. So, any final questions before I round up? Perfect. Okay, so for the clarity of the committee and for the benefit of any members of the public present, I'm just going to read out that the committee notes the performance against the business plan relevant to committee, including the issues raised and measures to address performance issues to be implemented by relevant service. So this concludes this item, and I just ask committee to note the report. So finally, I'd like to thank everybody for attending. The next Adult Social Care Committee meeting is on Monday, the 24th of March, and I'd like to thank our lone public member as well. So thank you very much.